Here are the best intermediate knee physical therapy exercises. First and foremost, sorry for the bait and switch. There really are no best physical therapy exercises. The best exercises are going to cater to the individual, how irritated they are, what they're trying to get back to, right? If you guys want to check out an evidence based treatment guide to patellofemoral pain, which is the most common physical therapy knee injury treated in the United States, anyway, put a link in the show notes. And if you've missed the beginner exercises for knee pain, physical therapy exercises, I'll put a link in the show notes. And also, you can click right here and check it out, right? So if you don't want to listen to me drone on about the reasons why I like these exercises, I have put timestamps below. You can skip directly to the exercise and not hear the rationale. Okay. However, next I'm going to talk about the rationale behind selecting these exercises. So, what pathologies are we going to be talking about today that are helped by these movements? So, one, the patellofemoral joint complex. So, things like patellofemoral pain, patellar tendinopathy, Osgood-Schlatter syndrome, quadriceps tendinopathy, patellofemoral cartilage injuries, and patellar instability. Okay. So, secondarily, some pathologies that would also benefit from these exercises are going to be tibiofemoral joint complex issues, right? So, this would be meniscus pathology, tibiofemoral osteoarthritis, cartilage injuries, ligamentous injuries, so ACL, PCL, MCL, and LCL. What I will say about tibiofemoral joint pathology is that it's a little bit nuanced, right? When you start talking about ACL injuries, when you start talking about, let's say, posterior medial meniscus pathologies, the stress that these exercises give, it's not as specific in terms of the phases I've written out. So phase 1, 2, 3, 4. So I would say that these movements are definitely helpful for these pathologies, but it's more specific to pathology in the patellofemoral joint. So the best physical therapy program is going to be well-rounded. Most of the movements I'm going over today are more targeted towards the knee and the quad, although we're also going to be strengthening the hip with these movements, right? But a well-rounded program should consider adding some hip strengthening, some hamstring strengthening, some calf strengthening, right? So we want to make sure that we're well-rounded in our approach. The second piece of the best program is going to be thinking about specificity. So basically, we want to meet the specific demands of what your patient is attempting to get back to, right? So if you have a patient that's just trying to get back to gardening in the backyard, we don't have to go crazy in terms of our exercise selection. If we're trying to get a patient back to Olympic weightlifting, so basically catching a heavy load in the very bottom position of a squat, obviously this can be a little bit more stressful on the knee. We make sure that we prepare that athlete to get back to the activities we want to get back to, right? So I wanted to go over some key notes about phase 2, right? So in phase 1, these are the easiest exercises. This is for the most irritable person, someone who's really aggravated, really cranky knee, right? Phase 2 is someone who has a little less irritation, is really to advance that next level, all right? This is going to be maybe a more appropriate starting point for someone who's more advanced generally from a strengthening perspective, right? So you have someone that maybe is pretty irritable, but they've been training for years and years. They're probably going to be able to handle a little bit more than just those basic beginner exercises. So you might start them here. Or if you have someone who's very irritable when you go through phase 1, now they're ready for something that's a little bit more challenging. What I will say is that some folks never even need to get to phase 3 and phase 4. They may do extremely well with just phase 1 and phase 2 exercises. So just keep that in mind, right? So what's different about phase 2 over phase 1? So first and foremost, we're using slightly heavier loads. So we were working on assisted movements and bodyweight movements in phase 1. Now we're moving on to movements that require dumbbells and maybe goblet holds, so holding a kettlebell up front, just like this, or holding a weight in your hands, right? We're using more moderate ranges of motion. So you'll see full range of motion split squats, medium box step ups over partial ranges and short boxes, right? We're also starting to go deeper in our squats. So we're starting to get to the point where we're just below parallel or parallel. Our speeds are increasing slightly. So in beginner stages, we're going very slow. That's a very irritated joint. Can't handle the speed. Now we're just stepping it up a little bit. The other piece you'll see on phase 2 over phase 1 is we're adding a little bit more anterior knee translation. So if someone has a very irritable knee, it's not going to handle the knee traveling forward during given exercises. Thinking about going down the stairs. If you have someone who has a really irritated knee, going down the stairs feels like garbage. It's because you're anteriorly translating your knee, or excuse me, weight over your knee, which increases stress in the patellofemoral joint, right? So what you'll see is in phase 1, it's more an emphasis on posterior weight shift. So think about a box squat, seeing your hips back to a box. Phase two, we're thinking about, okay, let's bring the knees forward a little bit more so and put some more stress through that knee because it tolerates it at this point. Okay. So let's go ahead and get to the exercises.
How it's supposed to feel. How it's supposed to How it's supposed to
So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt. They want to get back to training. All right. Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay. So a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a fitness pain free mini course. Definitely check this out.